Welcome back to our ACG learning series, and in this video, we'll talk about delta wave. Delta wave definition is actually very simple. It is the slurred upstroke in the QRS complex. So if we look at this EKG recording here, we can see that we have a P wave, which appears normal, and after that, the QRS complex starts prematurely here with no PR interval. As you can see, the PR interval is very short. And the slur, as you can see, it's very slurred. It starts gradually and prematurely. Okay, so what is the physiology behind this? If we look at this heart, this is the normal conduction system. I have the SA node here and AV node here. AV node will delay electricity from going to the ventricles prematurely. This will give me the PR, normal PR interval, right? Just remember, PR interval should be from between 3 to 5 small squares. Now, in cases I see delta wave, it is very diagnostic for something called Wolff-Parkinson-White Syndrome, WPW syndrome. What is this syndrome? It's very easy syndrome. There is, in these cases, it is relatively common. We see it a lot. We can see like an accessory pathway connecting the atriums and the ventricles. As you remember, there is a fibrocartilaginous ring separating the atria from the ventricles in order to insulate the electricity from going to the atrium to the ventricles. And all the electricity should come from the AV node and through bundle of Hess, right? Now, in cases of WPW, I will have an accessory pathway here. So when the electricity is going everywhere in the heart, it will use this accessory pathway to go to the ventricle. And so the ventricle contraction will start earlier, right? Now, please note that when the electricity comes from here, this is not a professional conduction system. So the electricity will be slow going here. And we can see that the QRS complex duration is prolonged, right? We remember that QRS complex should be less than 3 small squares. In this case, it is 1, 2, 3, and 4. Actually, 3 small squares is prolonged. If we want to be very precise, if the QRS complex is 3 small squares, this is prolonged, okay? Now, so again, I have this accessory pathway. Electricity will be conducted to the ventricles prematurely. This will let the QRS complex to be initiated prematurely. So the PR interval will be very short, right? Because there is no normal delay here in AV node. And this electricity here is much slower because it does not follow the normal conduction system. So the QRS complex will be enlarged. However, guys, now AV node still receives the same electricity, right? It will delay this electricity. And after a while, it will conduct this electricity to the ventricles, right? This electricity now will go through the fast pathway, the professional pathway. And this electricity, because it's going with the normal physiology pathway, will supersede and will omit this accessory pathway. So the rest of the QRS complex will be normal in shape because the faster the electricity, the heart will obey that electricity. All right. So again, delta wave, as we say here, it is a slurred upstroke in the QRS complex. And whenever you see a delta wave like this case, you have to think about Wolff-Parkinson-White Syndrome. And actually, there is a triad, characteristic triad for WPW, which is the delta wave itself. Number 2 is short PR interval. And when we say short PR interval, it is less than 3 small squares. And there is a broad QRS complex, which is equal to or more than 3 small squares. Again, if you look here, the PR interval is 2 small squares, which is shortened. And the QRS complex is 4 small squares, which is prolonged. And there is the slurred upstroke here, which is the delta wave. Note again that the remainder of the QRS complex is normal. Why? Because the conduction still occurs through the AV node. And this is actually the dominant physiological pathway. So on arrival to the ventricles, this conduction, the normal conduction, will cancel any other pre-excitation pathways and will prevent the accessory pathway from functioning, okay? This is very important. Just remember that, because we are talking about physiology, In Wolff-Parkinson-White syndrome, you have to avoid any AV blocking agents, just like calcium channel blockers or beta blockers, because they will suppress AV node and they will keep the accessory pathway unsupervised, and it will start to have a tachycardia because all the electricity from the atria are going to the ventricles through the accessory pathway. And that's it for the delta wave. I hope you enjoyed this video.